Hello students, so today we are going to deal with another good topic, that is accidents, causes and preventions in children. Okay, so what can be the various accidents that usually happens in a children? There are various kinds of accidents that usually happens in a children. We can say suddenly they touches the hot things, right? Electric supply, they used to go and touch it. They used to keep the beads, the buttons, the coin inside their mouth, right? While crawling, they used to come in front with various kinds of small objects which they used to see that something is very lovable and they are love to eat this. So all the things, whatever they put inside the baby's mouth, they are causing some or the other harmful to the babies. So these are the various accidents that happens in the babies or the children's. So let's begin with the introduction about this. An accident, it's commonly occurring incident, often with the lack of intention or lack of supervision. So we can say what is actually an accident. Accident is not only rash driving or not wearing helmet, and because of that accidents happens. So accidents also happens in children, right? Where this incidents, it basically happens where there is a lack of intentions, or we can say there is lack of supervision by their parents. So at that time some of the other accident happen, because babies, they are very small, they don't know what is harmful for them or what causes accidents, what is good for them. They accidentally jumps into some or the other incident, and because of that accident happens. About 1 million children below the 18 years of age undergo accidents and need to be admitted in emergency care unit. So we can just see the status or the data. If we see about 1 million children below the 18 years of age undergo accidents. So we are seeing this case that 1 million children, right? 1 million children who are under the age of 18 years, they happen to cause accidents, and they had to get admitted in the emergency care unit, right? So safety is an important aspect of the child health, as injuries are one of the leading causes of child mortality. So we can say safety, it is very much an important aspect of the child's health. Why? Because injuries, they are basically the leading cause of the child mortality. Parents need to understand about keeping supervision of the children in and surrounding home. Now, it is the responsibility of the parents. They should keep an eye on their children's what they're doing it, right? Because children, they used to create some or the other kind of hurdles, right? And because of that, some kind of mishap or the accidents happen. So the parents' responsibility is that they should have a proper supervisions on their children's. Identifying the risk and its preventions. So how can we define accident? An accident is an event independent of human will caused by outside force acting rapidly, resulting in physical or mental injury. So we can say, how can we define accident? Accident, it is basically an event independent of human will, in which the human is not allowing itself, right? It is being happening accidentally by outside force, something or the other thing, by touching on the plug, the child gets shock. So accidentally it happens, that is by outside force acting rapidly, resulting in physical or mental injury. So which is acting rapidly, and because of that which is being resulting in the physical or the mental injury. So we can define accident as it is an event independent of the human will caused by the outside force acting rapidly, resulting in the physical or the mental injury. Accident is an unexpected, unplanned occurrence which may involve injury. So we can say, how, another words we can define accident. Accident is an unexpected. We are not expecting that accident should happen to us. It is an unexpected thing which is unplanned. We have not planned anything. We have not seen the future. So that is unplanned occurrence which may involve injury and which can cause the injury. So we can define accident as it is an event independent of the human will caused by the outside force acting rapidly, resulting in the physical or the mental injury. Accident is an unexpected, unplanned occurrence which may involve injury. What is injury? How can we define injury? It is an intentional, unintentional change to body due to exposure to an external agent which can be thermal, electrical, chemical or any agent. So how can we define injury? Injury is something that happens intentionally also and that happens unintentionally also, right? So change to body. Why? Due to any external agent, due to exposure to an external agent, some external agents, because of that this injury happens. What can be? It can be thermal injury, it can be electrical or it can be any agent. So this is a way we can define the injury. So injury is what? Injury is an intentional or unintentional change to body due to exposure to any external agent which can be thermal, electrical, chemical or any agent. So children, they are more likely to injure than adults. Why? What is the reason the children get more injured? First is the children have softer or for their size bigger head than adults. So we can say children's, they are having the softer or we can say the size and the bigger than the adults. Second is children don't always know how to keep themselves safe. They haven't learned yet. Because children, they are very small, they are just growing it, right? They are coming to know what is good for them, what is bad for them. Actually, they don't know what are the things that harms them. They are just learning it, right? So because of that reason, the injury happens. Children have small arms, legs, hands, feet, fingers that can caught in small gaps as well as holes. Because the children, they are having small arms, small hands, small fingers and that can be easily get inside into any holes or we can say any gap which can cause injury. If a baby, he put a small finger inside the electrical outlet, the baby can get the shock. Right? Young children have thinner skin than adults and the skin can be easily hurt. So we can say these young children, they are having very thinner skin, right, than adults, and in this way their skin can easily be hurt. Children are shorter than adults, so they are less likely to be seen, for example, by drivers on the road and less able to see what's going on. Then what is the reason why the children get hurt? Children, they are smaller in size. The driver who is driving the vehicle is not able to see the children and because of that accidents can happen. So this is the reason why the children, they are having more injured than the adults. So if we see the incidence rate of these accidents, one child every hour one child dies from an injury. If we see the incidence rates, one child every hour, one child dies from an injury. 1 in 5, that is about 1 in 5 child death is due to injury. If we see the rate data, about 1 in 5 child death is due to injury. 4 seconds, if we see, every 4 seconds a child is treated for an injury in an emergency department. If we see another incidence, every 4 seconds a child is being treated for any kind of injury in the emergency department. So this is the incidence rates of the accidents that happens in our children. Every hour one children dies off from an injury. About 1 in 5 child death is due to injury. Every 4 seconds a child is treated for an injury in an emergency care unit. So what are the causes of accidents? What are the main causes of having this accident? The important causes of accident are as follows. Not using zebra crossing and not following the traffic rules. First is not using the zebra crossing and not following the traffic rule. Because of that accident happens. Not wearing helmets, breaking the traffic rules. Not wearing the helmets and breaking the traffic rules. If we see the adolescent children, they are using the rash driving, not wearing helmets and even not following the traffic traffic rules. So because of that, accidents happens. Lack of playgrounds. The children, they're not having playgrounds, so they are playing by the side of the road or in the middle of the road. So because of that, accidents happens. Keeping infants and toddler alone in the car and at home. You're keeping the infants and toddler alone in the car or in the home. Overcrowded seat. Because of overcrowded streets, accidents happens. Impulsive behavior of the boys. Example, often indulge in the risky act. Impulsive behavior by the boys. So because of that, of their risky behavior, accidents can happen. Use of knife or sharp items. Using of any knife or sharp item, because of that accidents happen. Inability to take decision about having danger. Whether there is danger or not, the child is not able to know. So because of that, accidents happen. Because of more curiosity and putting anything in mouth. Example, coin, marble, nuts may get aspiration. So because of curiosity, what is that? What is its taste? So because of that, the child put everything inside his mouth. So because of that, this accidents can happen. Okay, so these all are the basic causes of accidents. First is not using the zebra crossing and not following the traffic rules, not wearing helmets, breaking the traffic rules, lack of playgrounds, keeping infants and toddler alone in the car or in the home because of overcrowded streets, impulsive behavior of the boys, example, often indulge in the risky act, using of the sharp knife or any items, inability to take decisions about having a danger, and because of more curiosity and putting anything inside the mouth. It can be coin, marble, nuts, etc. It may get aspiration. Hello students. So today we are going to continue with our accidents and how to do preventions of accident. Will be continuing with this topic. So in previous class we have learnt about the incidence rate of accidents, in which we have seen one child, that is every hour one child dies from an injury, and 1 in 5, that is about 1 in 5 child death is due to injury, and every 4 seconds, if we see every 4 seconds a child is treated for an injury in an emergency department. So this was the incident rate of accidents. So let's move on to the causes of accidents. What are the actual main reasons for the causes of accidents? So the important causes of accidents are as follows. First is not using zebra crossing and not following the traffic rules. So we can say the first and the important point is not using the zebra crossing and not following the traffic rules. Nowadays the adolescents, they are so rash driving is there, and they are not seeing even the traffic light also. Whether it is a red light, they used to speed up their vehicle and they want to go fast, right? So first, they are not following the traffic rules by not waiting for the green light to come, right? And second is they're not using the zebra crossing, right? Even the vehicle is pass on, the traffic lights, red light is there, green light is there. The adolescents groups, or we can say the children, they are ready to move, to walk even in a simple road without any zebra crossing, right? They are not following, or they are not using the zebra crossing. So we can say not using the zebra crossing and not following the traffic rules. Second is not wearing helmets and breaking the traffic rules. Yes, because of not wearing the helmets, lots and lots of accidents happens, head injury happens, and thus the patients, we can say the children, they at most dies because of that, or we can say they are having a severe brain injury. So because of why it's all happening? Because of not following the traffic rules, not wearing the helmets. Third is lack of playgrounds, because the children are not getting sufficient area to play in a particular part, right? So they are utilizing the playgrounds, they are utilizing the road as their playground, they are riding the bicycle in the, we can say, the roads. So, because of all these factors, right, the accidents can happen. The lack of playgrounds. Next is keeping the infant and toddler alone in the car and at home. This is actually one kind of accident that happens with the children, right, in which we can say we are keeping the infant or otherwise the toddler inside the car, and we are locking the car and just we are going on to a nearby shop to purchase anything. So because of that also, the infant or the toddler, they get suffocation inside, sitting inside the car, and thus they face lot of trouble, and in this way the accident can happen. In the same way, if you keep the children alone in the home, right, we don't know what all are the things, what all are the, we can say, the various things they are going to do when they are alone inside their home, right. So keeping infants and toddler alone in the car and in the home. Next is overcrowded street. The fifth point is overcrowded street. Sixth is impulsive behavior of boys. Example, often indulge in a risky act. So we can say impulsive behavior of the boys. It also results in we can say it is also one of the main reason for the causes of accident. Next is use of knife or sharp items. So we can say the next point is if the children, they are using or they are playing with any knife or any sharp items, it also result in accident. Next is inability to take decision about having danger. So next point is inability to take decision about having a danger. The children at certain age, they are not able to guide themselves, whether in front danger is there or not, or whether it will harm them or not, right. So inability to take decisions about having danger. Next point is because of more curiosity and putting anything in the mouth. So we can say if the children, nowadays the children are more curious to know what that thing is, how it tastes, what does it smell. So they used to put each and every item inside their mouth to know. So because of that also it creates the accidents. Why? Because the children unintentionally or intentionally, they will be putting any small things. So we can say the buttons, beads, marble inside their mouth, and hence the accident can happen. So these all are the various causes of accidents. So first is not using the zebra crossing and not following the traffic rules. Second is not wearing the helmets and breaking traffic rules. Third is lack of playgrounds. Fourth is keeping infants and toddler alone in car and home. Fifth point is because of overcrowded street. Sixth is impulsive behavior of boys. So we can say indulging in any risky acts. Next is using of knife or any sharp items. Eighth is inability to take decision about having any danger. Next is because of more curiosity and putting anything in the mouth. We can say example coins or marble, beads. Because of that accidents can happen and they may get aspiration. So these all are the causes of accident. Next is what all are the common childhood accidents. So we can say first is fall. So first common childhood accident is fall. So fall, how can the child get injured? Fall from furniture, from stairs, unguarded window, terrace. So we can say the fall can happen. It can happen from falling from the furniture, from the stairs, from the unguarded windows, or we can say from the terrace. Second accident that happen is burn. That is a common accident, usually happen in the children residing in the rural areas also, as well as in the urban areas. So children, they may get burned from heating appliances like stove, iron, heater, etc. They may get burned. So we can say the children, they can get burned from heating appliances like stove, iron and heater. So these all are the, we can say, the burning appliances because of which the children can get burnt. So they may get burned. So we can say first is in burn also there is open fire, and because of hot liquid also the burn can happen. So how come open fire?
like fireplaces, outdoor fires, matches, lighters. So because of this also the fire can happen. So this is what this is about, open fire, how the children can get burn themselves in open fire. So in open fire there is fireplaces because of that, second is outdoor fires, and third is matches, and fourth is lighters. Then comes the hot liquids, right? So because of falling any hot liquid, we can say into the child's body, it can also result in burns. So we can say bath water, this is a common incident or accident happens in a children. Hot water, taking a hot water, or just owning the tap water that is very hot, or we can say if a mother is boiling the water in the kitchen, right? So if in the absence of mother, if the children they go and touch that hot liquid, it will fall above the child. So because of that also burn can happen. So that is bath water. Then cooking fluid, any cooking fluid, then tea, coffee, etc. Because of falling, we can say to the child, it can result in the burn. Next burn can happen is via electric circuit, right? So any defective wiring, by chance if a child crawls and touch any defective wiring, so because of that also burn can happen. Next is unguarded outlet. Unguarded outlet, we can say the outlet that is open, right? So in by chance or in case the children, or we can say the infants, they just comes or crawls or walks and touch the unguarded outlet, it can also result in burn. So we can say the electric circuit, so in which we can say because of any defective wiring. Second is unguarded outlet, the burn can happen. Fourth is strong acid and alkalis, right? Because of strong acid and alkali, so it can be ammonia, hydrochloric acid. So we can say the strong acid and alkali because of any ammonia, falling ammonia, or any hydrochloric acid. So this can also result in the burns. So we can say first is falling, second is by burning, in which we have learnt about the open fire, hot liquids, electric circuit, strong acid and alkalis, right? Now next we can say the common childhood accident is drowning, right? So how come drowning? Drowning in bathtub, sink, well, swimming pool, ponds, ditches and rivers. So because of that also accident can happen. Nowadays we have seen many accidents related to how come the children nowadays they are very curious to take pictures beside the river or near the river. They used to take selfie of themselves, and because of that they fall at the back and they can be drowned in a river, right? So this is one of the common accidents nowadays. In this scenario it is happening. So it is we can say the major accidents, it happens in an adolescent. Why? Because of some curiosity, or because of them some liking, or wanted to see themselves differently, they used to do some kind of an act, and that is very dangerous to their life. Next is fracture and dislocations of sprain, right? For how can fracture and dislocation of spine can happen? Because of any, we can say the fracture of humerus bone, fracture of femur bone, sprain of ankle and joint. So this fractures basically can happen to our children, right? So this fracture, how come it can happen? Because of any falling or because of any accidents, basically the fractures can happen. So these all are the common childhood accidents. So because of any falling from where? From the furniture, stairs, unguarded window, terrace. Second accident that occurred is a burn. So burn can be open fire, hot liquid, open fire in which it will be fireplaces, outdoor fires, matches, lighters. Second is hot liquid. It can be in the form of bath water, cooking fluid, tea, coffee. Then third is electric circuit, in which we can say any defective wiring or unguarded outlet. Then fourth is strong acids and alkali. We can say because of any ammonia or hydrochloric acid, it can also result in burn. Third accident that happens is because of any drowning. Drowning where? Drowning in the bathtub, drowning in the ponds, river, sink, well, swimming pool. Then comes the fracture and dislocations of the spine, which can be happen because of any fracture of the humerus bone, or fracture of the tibia, or fracture of the sprain on the ankle. So because of that also accidents can happen. So we can see in this picture, these are certain kinds of accidents that usually happens in our children, right? So in which we can see the children in this picture, they are not using the zebra crossing, or they are just walking in the road itself, crossing the road, we can say. Second picture, we can say anything the child is putting inside his mouth, right? It can be medicine, it can be any acid. Third pictures, we can see it says stove is burning, any hot liquid is being placed and the child is crawling and trying to touch that hot liquid. So because of that touching, the burn can happen. Then in fourth picture, you can see the child had an accident. The child has fallen from the cycle and has got injured themselves or himself. Fifth picture, we can see a child, or we can say an infant is crawling and touching the unguarded outlet, right? So because of that also the accident can happen. Okay, next accident that happens in the children is by a motor vehicle, right? Both as a passenger and a pedestrian, children may get injured. So we can say motor vehicle accident can also happen. So in which we can say the passenger as well as the pedestrian, the children may get injured themselves. Next is poisoning, in which we can say the drugs like aspirin, sedative, antihypertensive, transducers, insecticide, cleaning agents, kerosene, etc. So because of this also the accident can happen. So in which we can say the poisoning we can say some drugs like the aspirin, sedatives, antihypertensive, transducers, insecticide, cleaning agent, kerosene, etc. Next comes the because of any suffocation. So suffocation, we can say how suffocation can happen: plastic bag, discarded refrigerator, big tins, etc. So we can say intentionally or unintentionally the child he put the plastic bag inside his head, right? He put the plastic bag inside the head, right? He put his head inside the plastic bag. So because of the suffocations, the children can cause the accidents, or we can say children can injure themselves. Next come the cuts and puncture. Because of any cuts and puncture, the accident can happen. Cuts and puncture how? With the help of a knife, then scissor, large needles, broken glass and tools. The cuts and puncture can injure themselves. Then crush injury. Crush injury how come? With the help of a throw ringers. Next come the animal bite. Animal bite, we can say dog bite, cat bite. So because of this, the accidents can happen, right? So we can say these all are the various accidents occurring in we can say the common childhood accident, right? In which we have learnt about the falls, second is burn, third was drowning, fourth is fracture and dislocation of sprain. Next come the motor vehicle accident, poisoning, suffocations, cuts and puncture, crush injury, animal bite, right? So these all are the common childhood accidents. Now let's move on to the types of accidents, right? What all are the various types of accidents? So the types of accidents we'll be seeing is, first is according to the location where accident occurred, there are of two types. So we can say according to the location where this accident has occurred, there are mainly two types of accidents: occurring outside of home and occurring in the home. So we can say some accidents that occur outside their home is one type. Second is occurring in their home, that is inside their home is another type. As per the severity, accidents can be classified into major accident and minor accidents, right? So we can say according to the location, it is being divided into two types, occurring outside of home and second is occurring inside of home, right? Next is according to the severity, the accidents can be classified into major accident and second is minor accident. So let's learn more about the accidents, so in which we will be learning now common accidental injury and its prevention in different age group, right? So we will be learning accidents according to the various age group. Now first learn about the accidents that happen in the infants, right? So what is the age group of infant? Infant is 0 to 1 year is infancy group, right? So what are the accidents usually happen in a infancy group? There are many kinds of accidents that happens in a infancy. Why? Because infancy is a period when the child is very small. He is not able to understand or he is not aware about what is good things for him, what is bad things for him, what is good to eat, what is not too good to eat, right? So we can say in this duration only the child learn to sit, the child learn to stand, the child learn to crawl, right? So this is a big duration and maximum number of happen during this phase itself, right? So the accident that happen in infant are as follows: cuts, falls, suffocations, ingestions, right? So we can say there can happen cuts, falls, suffocations and ingestion. So you can see in this picture also it being says in infants cuts can happen, right? Cuts can be in the form of a mother is just cutting his nails. So because of incidentally or accidentally the mother cut or mother or father, okay, it cut his beside the or behind the nails skin area, right? So because of that also it can happen. Intentionally or unintentionally use of knife or any sharp instruments, right? So because of that the cut can happen, right? And the child in infancy itself, the child is in the crawling stage. The child crawls or some things comes in between, the child is crawling, so it can also result in cut. Second is falling. Yes, this is a common thing that usually happen in the infants, right? Because the infant, sometimes the infant is lying on the bed and the mother, she leaves the child and do some other work. So the child can fall from the bed, right? Or when the child is learning to sit, the child can fall, right? In the same way when the child is learning to walk, so at that time also falling can happen. So falling can happen from the table, from the chair, from the bed, from the sofas or by itself also, right? Next is suffocation. As I have told you, anything the child put inside his head, right? So because of that suffocation can happen. Or if a child is closed inside closed room, so because of that suffocation can happen, right? Next is egestion. So as I have told you, the child in this duration learns to crawl, learns to creep, many things comes in between and the child loves to take everything and want to taste, right? So because of that tasting, egestion can happen, right? So the child can ingest, we can say ingest the small things like the coins, buttons, beads, marble, seeds, right? Next is burn. So we can say burn is a major accident that happens usually in the infancy time, right? Where unintentionally or intentionally touching the hot liquids, right? So because of that the burn can happen. Hot water baths, right? So these all are the various accidents that happens in a infants, right? So it is the caregiver's responsibility to take care of their child, not to touch any hot liquids or not to ingest any small things that can harm their life or any accidents can happen. Next is how can we prevent this accident, right? So first is never keep the child alone. First and important thing is you should never keep the child alone in the home or in the car. Always one caregiver should be with the child, because the child doesn't know what is good for him, right? The child is unaware about everything. So it is the caregiver responsibility to look after the baby, what the infant is doing, right? So never keep the child alone. Next is small tiny toys, right? As I have told you, the small things the child can ingest, right? So you have to keep all these things aside or something upstairs where the child's hands cannot reach. So second point is you have to keep all these small tiny toys away from the child's reach. Third is electrical appliances, right? So we can say the unguarded outlets can be closed, right? And if any defective wiring is there, just repair all that thing. You have to keep all the iron, heaters away from the child's reach. Next is avoid solid food items, keep away the stove and the fire. Next is you have to keep away the solid items as well as the, we can say the stove and the fire away from the child's reach, right? So these all are the various preventive measures. First is never keep the child alone. Second is you have to avoid small tiny toys and you have to keep them away from the child's reach. Third is electrical appliances. Fourth is avoid the solid food items away from the child's reach. Even the fire, the stove should be kept away from the child's reach, and at least one care provider should be there with the child who should look after the child. So these all are the preventive measures for the infancy. So, never leave an infant alone in the cot or a table, any unprotected place to prevent the fall. So, we can say first point is never leave an infant alone in a cot or a table, or you have to any unprotected place to prevent the fall. Second is never give small things to infant. As I have told you, the beads, the marble, coins, seeds, you should not give anything to the in the child's hand. Toys should not have small parts which can be aspirated and put into ear or nose. So we should be careful, like we should give advices to the parents that toys should not have any small parts. So we can say the separated parts, right? Some toys are there in which their parts can be separated, right? Even the small things, the small eyes or the ears can be separated from the toys. So these kind of a toy material should be kept out of the child reach, or we should be advising the parents not to give such type of toys to their children, right? Why? Because such parts can be aspirated by the child and the child can put easily into his nose and in the ear. Next is never feed solid which are difficult to swallow or chew, right? Now you have to make sure that as the parents, you should not give any solid things to chew or bite, right? Next is coins, button, marble must not be left within the child reach. You have to make sure that the coins, the marble, the beans, everything should be kept away from the child, right? Because the child can ingest easily these small things, right? We can see even the small battery, right? We can see the small size battery. We used to say mini battery that is coming, right? Usually to put inside the remote, right? TV remote, right? Small mini size battery is coming. Even that battery also this infant can ingest. So you have to be careful about each and everything. Nothing should be there beside, or we can say in the child's reach. The child can easily take and ingest it, right? So these all are the various accidents that happens in an infant, and as the caregivers, what all are the preventive measures to be followed. Second age group that comes is the toddler period, right? Toddler age group. So toddler age group begins from the 1 year to the 3 years. That age group we used to say as the toddler age group. So accidents can happen in toddler also, right? What are the accidents that happens in the toddler age group? First is the thermal. Second is aspiration. Third is electrocution. Fourth is falling, and fifth is drowning. So these are the accidents that happens in a toddler, right? So what are the accidents? Thermal, aspirations, electrocution, falling and drowning. So these all are the accidents that happens in a toddler age group. So you can see in this picture also, it is being very easily understandable, right? In which you can say, first picture depicts about the thermal thing, right? Something hot things or hot liquids. The child is, just because the child has learning to walk, he will be walking, he will be experiencing each and everything. So he will be going and touching each and everything, want to know, due to some curiosity. The child want to know what is actually that thing. So the child will be touching each and everything. So at that time also this accident can happen. So thermal burn can happen to a child. Next is, you can see in this picture falling, how a child is, we can say, child is inside the cupboard and want to go more and more up, right? And because of that also accident can happen. Next, you can see in the third picture, drowning, right? While learning to swim, right? Or while sitting near the pond, the child can accidentally slip into the pond or the river or the swimming pool. The accident can happen in children. Next, you can see the electrocution, right? Unguarded outlets, defective wiring, the child is unintentionally going and touching that board. So because of that also accident can happen to a toddler. Next is, you can see this washing machine also, in which the child will be opening the front load washing machine and want to see what is actually happening inside that washing machine, right? Sometimes the child is so naughty that they will be going inside or sitting inside the washing machine, right? And the parents will not be aware. In by chance, if the mother, they on the washing machine, the child can die also. So these all are the various accidents that happens in children, right? So we can say in the toddler, even aspiration can also be done, right? You can see in this picture, coin, beads, you can see the small marbles, small beads, any small things the child can chew and swallow. Right? So these are the various accidents that happens in we can say the toddler: thermal, falling, drowning, electrocutions and aspiration. So what are the preventive measures for this toddler age group? First is, avoid negative words. You don't have to harsh your child, or you don't have to say harsh words or negative words to your toddler, right? Next is, harmful agents should be kept away from the child reach. Clothing, right? Next is, supervise constantly, each and every parents, right? Their utmost responsibility is to supervise their children, what their children is doing, right? Flooring, right? Because of slippery floor, the child can fall. So you have to avoid that slippery floor. If any water is fall down, if there is any wet floor, you have to make sure that you should make it dry. Otherwise, the child can slip easily in a floor. So prevention, we can say, you have to give proper direction to certain activity. You have to give proper direction to certain activity, means you have to guide your child. This is right for your child, this is wrong for your child. You have to give proper direction to the child, so that the child is also aware, yes, if I will be touching this, I can get burned, or if I will be doing this, I will be harm myself, right? So as a parents, it's your responsibility to guide your children, right? Second is, keep constant supervision. At least one care providers should supervise their child, what their child is actually doing it, right? So keep constant supervision. Third is, keep harmful substance like hot things, drugs, poison, kerosene oil, electrical appliances, sharp object out of child's reach. So we can say you have to avoid all this harmful substances, like we can say the hot things, right? Then any drug is kept, poison is being kept, kerosene oil, electrical appliances, then any sharp objects, right? You have to keep all this out of the child's reach. Then next point, you have to make sure that you should give adequate instructions to the caretaker to look after the child and follow proper precautions. In some households, there are some caretakers who caretake their children, right? So as a parents, you have to give proper instructions to the caretaker, right? To constantly supervise, constantly make sure that what child is doing, the caretaker responsibility to make sure that the child doesn't fall into any kind of accidents, right? So you have to give proper instructions to the caregiver as a parents. Next is provide safe play materials to the children, right? Because as I have told you, there are certain toys which can be easily separated, which can be easily taken out, right? So these kind of toys, you have to make sure that you have to avoid from the child's reach, or as a parents, don't give such type of toys to your children. Floor should be slippery. Floor should not be slippery. And one of the important point as a parents, you have to make sure that the floor should not be slippery. If any water is fallen from anybody's hands, you have to make sure that make it dry. Or while mopping, there is too much wet or too much moisture is there, you have to clean it with the dry clothes. Okay. So these all are the various preventive methods. Give proper direction to certain activity, keep constant supervision. Third, keep harmful substances like hot things, drug, poison, kerosene oil, electrical appliances, sharp objects out of child's reach. Then give educate instructions to the caretaker to look after the child and follow the instructions. Next is you have to provide safe play materials to the child. It should not be separated. Small parts should not be separated. Next is floor should not be slippery, right? So these all are the various preventive measures for the toddler. Furniture should be placed firmly to prevent falls. You have to make sure that you should also keep the furniture in a perfect place to prevent the falls. Child should not be allowed to play with cord, plastic bags or pillow to avoid suffocation. So you have to make sure that children should not be allowed to play with any cord or plastic bags or any pillow to avoid the suffocation. Next is electric switch should be out of child's reach. You have to make sure that the electric switch should be out of the child's reach, right? So these are the various preventive measures as a parents you can take sure, and as a nursing responsibility also, it is the responsibility to give advices to the parents, right? First is you have to give proper directions to certain activity. Second is keep constant supervision. Third is keep harmful substances like hot things, drug, poison, kerosene oil, electrical appliances, sharp objects out of child's reach. Give adequate instructions to the caretakers to look after the child and proper follow instructions. Provide safe play materials. Floor should not be slippery. Furniture should be placed firmly to prevent falls. Child should not be allowed to play with cord, plastic bags or pillow to avoid suffocation, and electric switch should be out of the child's reach. Next, we'll be learning about the adolescent, right? We have learned about infant, we have learned about adolescent, now we are going to learn about, we have learned about toddler, now we are going to learn about adolescent. So, accidents can happen also in adolescence. So, what are the various accidents that happens in adolescent? Instrument injury, road traffic accidents, sport injury, electric current, right? So we can say in preschooler as well as in the schooler child also, right? Till 12 years, we can say what we learned about the infant and the toddler, what are the accidents that happen, that also happens in a preschooler and the schooler child, right? And various preventive measures that we have learned that is applicable for the preschooler and the schooler. So preschooler, we will be saying 3 to 6 years is preschooler and 6 to 12 years is the schooler age. Now after 12, that is 12 to 18 years is the adolescent age, right? So what are the accidents that happens usually in the adolescent? We can say there is instrument injury, road traffic accident, sport injury, electric current. So these all are the accidents that happens in an adolescent. Instrument injury, road traffic accidents, sport injury and the electric current. So you can see in this picture also, right, there is an image. You can say some happens because of any instrument injury, right? Something might get caught, so because of that instruments injury can happen. Road traffic accidents, you can say rash driving, not following the traffic rules, Because of that, accidents can happen, right? Any sport injury can happen, we can see, right? While playing football, while playing cricket, while playing table tennis, or while playing, we can say, kho, any kind of sport injury can result in the, we can say, the injury or accidents to the adolescent child. So now, what are the preventive measures for this adolescent age group, right? Now, adolescent age group is those age group in which the child bit matured, the child is able to understand bit things, right? Which we cannot say, we can say more things, right? So in this, it is a mature age, right? So if we will be making them understand, they will be understanding the facts if they want to understand, right? So next is, what are the prevention measures? First is by giving proper educations to their children, right? As a parent's responsibility, you have to make sure that you give educations to your children regarding the pros and cons of particular things, so that the children is aware about the cons, right? So he will be, if it is applicable for him, he will be following that things. Safe environment, proper training should be given to their children's, constant supervisions and guidance, right? Now, adolescent is a phase in which constant supervision should be noted by their respective parents, right? Constant supervision should be made because it is a maturity age, right? In which the child is in, we can say, it is a stage in which the child is in with the peer groups, their own peer circles are there, they love and they love to hang with them. So proper, we can say, supervision, guidance should be given by their parents, and proper educations regarding each and everything should be made understood to their children. Even about the proper traffic rules, even about the rash drivings, what are the pros and cons, right? And because of the, we can say, the accidental injury, anything can happen to the adolescent also. So we can say, teach for safety precautions with fire, electricity, sharp material, etc. Now, adolescent is a phase in which the child feels that he is mature enough. He want to be independent. He want to do oneself own activity. So we can say he will be doing the electric activity also. So precautions should be made with fire also, electricity also, and even the sharp material also. Teach the child for swimming. So it's your responsibility. You have to make sure that you should give education, or you should give teaching about the swimming. The children can learn swimming at this age. Why? Because now they are going to be mature adult, right? So they will be hanging out with their friends. They will be going near the pool, ponds, rivers, accidentally if they fall. So they know swimming and they can, we can say, they can save themselves, right? So children at this age, they should be taught about the swimming. Encourage to play in safe places and keep a keen supervision. What you have to do as a parent, it's your responsibility. You have to encourage your children to play in a very safe places, right? And you have to make a keen supervision. Next is, discourage the children to fly kites from an open roof or a terrace. You have to make sure that you should tell to your child they don't have to fly kites from the open terrace. Because why? Because any accidents can happen from the terrace also, right? The children can accidentally fall also from the terrace. So you have to discourage the child to fly kites from an open roof or a terrace. Teach the children about road safety, zebra crossing and traffic rules. You have to teach children about the traffic rules, about the zebra crossings and about the road safety rules. Next is, never leave the child alone in a car with keys. You have to make sure that you should never leave alone the child inside the car with the key, especially. Why? Because the children, they are in the very curious stage, they are in a mature stage, they will be turning the keys, they will be pressing the accelerator, right? They don't know, and in this way accidents can happen. So never leave the child alone in the car with the keys. So these all are the, we can say, the preventive measures for the adolescent. You have to teach for the safety precautions with the fire, electricity and sharp material. Second is you have to teach the child for swimming. Next is you have to encourage to play in safe places and keep a keen supervision. Discourage the children to fly kites from an open roof or a terrace. Teach the children about the road safety, zebra crossing and traffic rules. Never leave the child alone in a car with the keys. Now, these were all we learned about the various accidents, right? We learned about how to define accidents, what are the main causes of accidents, what are the incident rate of accidents, what are the various common childhood accidents, and we learn according to the age group what are the various accidents and the preventive measures, right? Now, what are the nurses' responsibility? Nurses as a main role can play in this, how to prevent this accident, right? So, we can say the nurse's role is forethought, discipline and time, right? So, what are the role of nurse in prevention of accident? First is home appliances, right? Home appliances in what sense? You have to keep all the sharp things like knife, scissor, etc. out of reach of children. So, as a nursing responsibility, you have to give advices to the parents that you have to keep all the sharp things like knife, scissor out of child's reach. Second is bathtub and bathroom. Never leave the child alone in the bathroom and near the bathtub alone. It is your utmost responsibility as a parents. You don't have to leave the child alone in the bathroom or in the tub alone, right? Third is buckets. How buckets? Filled with scalding water should never be left standing unguarded, right? The buckets filled with water, right? You don't have to keep the buckets full with water because the child can play inside the bucket and they can get drowned. Next role of nurse is crib. How crib? You have to keep side of the crib pulled up all time. Use a sleeping bag or a strap for a younger or an older baby, but never use pillow. Use short ribbons to make sure that baby cannot be strangled. You have to make sure that the crib should be at the side and there should be, we can say the form of bed should be there up also and the down also. If the child accidentally fall from the crib, form is there to support it, and you have to make sure that the thread wire, the short ribbons which is being using for a crib to hold the baby to move to and fro, you have to make sure that that ribbon should not strangle your child. Next point is electric outlets. So, electric outlets, we should say if not being used, cover the outlet with the tape. If that unguarded, we can say the outlet is not being used, you have to cover that outlet with the tape. Heaters. Next role of nurse can play is heaters. Radiators should be protected with radiate covers. Portable electric heaters should be used only when someone is in room to watch the baby. You have to make sure that all the heaters should be kept aside, right? If in case of any one person is there, then only the heater should be used. Next point is high chair. So, avoid high chair to prevent the baby to fall down, or use to strap the baby in to keep the baby from falling out. Otherwise, use low table and chair for eating will be safe. So, high chair. So, you have to make sure that you should avoid high chair. Why? Because while sitting in the high chair, or if the child is standing on the high chair, the chair can slip and the child can fall down and get injured themselves, right? So, you have to make sure that use a load size table, right, in which the child can easily sit and eat his food. Next is kitchen. So, in kitchen, we can say there are stove, cleaning fluid, insect poison, detergent, open cans, broken glasses should be kept out of reach of children. So, we can say in kitchen, there are very harmful things kept, right? So, you have to make sure that all that harmful things should be kept away from the child's reach, right? Why? Because in kitchen, there are stoves kept, there are cleaning fluids kept, there kept the insects, poisons, detergents, open cans, broken glasses, all things are kept there, right? So, these things can injure the baby. So, you have to make sure that all these things should be kept out of child's reach. These all are harmful items, should be kept in a locked cupboard. Never leave the child alone near these things. You have to make sure that these all are the very harmful items and it is very poisonous, it is very dangerous. You have to make sure that you should keep all these things in a locked cupboard, right? And you don't have to leave alone the child near these things. Next is medicine. Now, accidentally also these small children, they crawl and they get one tablet, they will be think something is there, it is very good and delicious, so they will be eating it, right? So we can say the medicines like aspirin, antihypertensive, sedative, transducers, whether prescription available or not, including all creams, lotions, hairspray, dyes, should be on a top shelf and a closet or a cupboard or a almara. So we can say these all medicines like aspirin tablets, transducers, the sedatives, whether prescription is there or not, all this medicine should be kept inside the closed cupboard. It should be locked, right? And it should be at the top, we can say the top cupboards, right? We can top floor of the cupboard so that the child cannot take that medicines. Otherwise, accidentally ingesting those medicine can result in serious accidents, right? Even the child can have poisons or die also. So you have to prevent these medicines from ingesting these medicines in the child's mouth. Next come the lighter and matchbox. So these things also should be kept in drawers with the lock. You have to make sure that these lighters and matchbox, these also should be kept in the drawers, or we can say it should also be locked. Next is toys. As we have discussed, the toys with the separated parts or the broken toys, it should be kept out of the child's reach. The toys with the parts that can be broken or having a small parts like screw, eyes of toy, doll that can easily be removed should be thrown away. So we can say those toys in which the parts can be removed, the doll's eye can be removed or ear can be removed, you have to discard all those toys. Never allow the child to play with small removable parts. Never give the child small beads, nuts, peanuts, small coin, because the child might put into the mouth and can aspirate, right? And can aspirate, right? So we can say the toys which is broken or which can be separated, you don't have to give those toys to the children, or you can discard it. Second is, you don't have to allow the child with play with the removable parts. Third is, you don't have to give the child the small things like we can say the beads, nuts, peanuts, right, or coins, because they can put inside their mouth and they can aspirate all those small things. Next is pillows. As a nursing responsibility, you have to get advices, all these things to the mothers. So in pillows, we can say never allow the child before the age of 1 year to play with soft pillow, because the child may put on nose and can get suffocated while playing. So we can say the pillows, right? You should not allow the child who is the age of under the age of 1 year to play with the pillows. Why? Because they can put on their nose, right? They can get suffocate themselves. Safety pin should be kept as inaccessible to the child. Even the safety pin also should be kept away from the child's reach. Then comes the stairs, right? So what is your responsibility as a nurse? You can give advices to the parents regarding the staircase. Have gate at the top and bottom of the stairs to prevent accidental injury. So you can put the gate at the top as well as at the bottom to prevent any kind of accidental injury. Because the child, when start to walk, he will be seeing the staircase. He will love to crawl on the staircase. He will love to walk on that staircase. So accidental injury can happen because of going in the staircase. Then painted furniture, walls, woodwork should be repainted with the lead-free paint if the old paint is not lead-free. So as a parent's responsibility, you have to make sure that you should repaint the paint, right, with using the lead-free paint, right, so that it should not harm the child. That is, paints, you have to make sure that Painted furniture, walls and woodwork should be repainted with lead-free paint, and if the old paint is not lead-free. Next is motor vehicle accidents. So, motor vehicle accidents, you can give instructions like never leave the child alone in the car with the keys. You have to give instruction to the children is that you should not leave the children alone in the car with the keys. Use safety belts for the child. Keep the car door locked properly while driving the car. So, it's your responsibility. You will be giving proper advices to the parents that you have to use the safety belt for the child. You have to make sure that you keep the door locked properly while driving the car. Okay, so these all are the various role of nurse in prevention of accidents. You can say first is home appliances, in which we have told you have to keep all the sharp things like knife, scissor out of child reach. Second is bathtub and bathroom. You don't have to never leave the alone child in the bathroom and the bathtub. Third is buckets filled with the scalding water should never be left unguarded. Crib, you have to make sure that keep the side of the crib pulled at all time. Use a sleeping bag or a strap for a younger or an older child, but never leave the child alone. And you also have to make sure that the use of short ribbons so that you should not strangulate your child. Next is electrical outlets. You have to make sure that all the unguarded outlets should be closed. Next is heaters. You have to make sure that you should prevent your child from getting burned. Next is high chair. You should always you should always make sure that the child should not use the high chair, otherwise he can fall from the high chair. Next is kitchen. You have to make sure that all the harmful items are there in the kitchen. You have to make sure that keep all that things in a closed cupboards. Harmful items like the stove, cleaning, we can say cleaning fluids or the liquid, insects, poisons, detergents, open cans, broken glass, all things are kept there itself. So you have to make sure that all things should be kept in a closed cupboard. Next is medicines. Various medicines are being used by the parents itself. So you have to make sure that all those medicines should be kept on the top floor of your cupboard or in a locked cupboard. Next is lighters and matchbox. These things also should be kept in the drawer or in the locked drawer. Next is toys. The toys with the broken parts or the separated parts should be discarded, right? And next is, you don't have to give your child small things like beads, nuts, peanuts, coins, otherwise the child can ingest and accident can happen. Next is pillows. You don't have to never leave the child alone, the child who is under 1 year of age with the pillows. Why? Because the child can keep the pillows near his nose and he can get suffocations. And you have to also make sure that safety pins should also be kept out of child's reach. Next, the staircase, in which the nurse's responsibility is to give advices to the parents that have gate at the top and the bottom to prevent any kind of accidental injury. Next, the paints. The painted furnitures, walls, woodwork should be repainted with the lead-free paint, right? If old paint is there, so you have to make sure that you repaint it with the lead-free paint. Next is motor vehicle accidents, in which you have to make sure that never leave alone child with the key inside the car, and also you should make sure that the child uses the seat belt when being inside the car, and the car should be locked properly. And also you have to give advices to follow the proper traffic rules. Use the helmets as well as the seat belts, and no rash driving. Slow vehicles should be righted. So how can we do the prevention of poisoning? So some of the substances such as insecticide, paint solvents, cosmetics, detergents, kerosene, nail polish, phenyl, turpentine, keep this away from the child's reach. So we can say these all are the very poisonous substances like the insecticide, paint solvent, cosmetics, detergent, nail polish, phenyl. These all are the very harmful substances, right? So these should be kept out of child's reach. Okay, next is teach parents about proper storage of kerosene, turpentine, polishing agent, insecticide and cleaning agent. You have to make sure that you teach parents regarding the proper storage of all these things, right? Kerosene or turpentine or any polishing agent, insecticide or any cleaning agent. Next is always put proper label to the container. You have to put the proper label in a container so that you are also aware about what things is being kept in that container and what things you are putting inside the lock and key cupboard. Next is poison substance should not be kept in a container used for food because the child may mistakenly ingest it. So we can say the poison substances should not be placed inside a container for the food. Why? Because the children knows that some food is being kept inside that container. The children will be going and taking that container and will be eating, right? So because of that also accidents can happen in children. And emphasize the need for medical advice when poisoning is suspected. If by chance some poison substance is ingested by the parents, so proper medical advice should be taken. That is, emphasize the need for medical advice when poisoning is suspected. So these all are about the prevention of the poisoning. Let's come to the conclusion of this accidents and its prevention. So accident could not be completely avoided, but its occurrence could be prevented. To prevent accident to children, adults should pay more attention to home safety. They should also clear any hidden hazards at home and teach children about the safety. So we can say accidents we cannot completely avoid it, but its occurrence can be prevented. How occurrence can be prevented? By proper supervisions, by proper guidance by the caregivers, by taking care of their children, by giving proper educations and training to their children, as well as they should know what things should be hidden at which parts and they should be kept out of child's reach, right? So accidents, it can be avoided. We cannot say accidents cannot be avoided, right? But its occurrence can be avoided. Right now, it is the responsibility of parents as the caregivers to take care of their children. Right? So hope you have understood about this accidents and its preventions, and you will be following all these things in the routine life also, and also giving the proper advices to the nearer or your dear ones. So thank you so much for your kind cooperation and your support. Thank you so much.